Nelson, and at age 18, I was diagnosed with pulmonary fibrosis, and at age 28, I had a double lung transplant. I will constantly be fighting for my life. I have to take medication twice a day for the rest of my life. I will be taking my vitals every day for the rest of my life. I may have to have another transplant eventually, but luckily with research, I may have these new lungs for many, many years, which is a great thing, and I'm very grateful.
My name is Kyle Clark. I'm from Mississauga, Ontario, and I'm 20 years old, and I live with asthma today. If you can't breathe, you can't live, pretty much, right? I've been in a lot of situations with my asthma where I haven't been able to breathe, and you know, I've been scared. It's a scary feeling, probably the most scared I've ever been in my life. Everyone needs to breathe, and the way we're going with research, it's going to help prevent people from getting sick. It's going to help control it from anything from lung cancer to, you know, just better air quality.
My name is Karen. I have asthma. I've had it pretty much all my life since I was 13. The research that's happened in terms of the impact of smoking on lung health and on future generations has been really important. Evolving therapies for asthma have helped a lot. I now take a combination therapy that wasn't available when I was first struggling with my breathing as a teenager. So I'm hoping that continued research will lead to better therapies.
Our research is working with patients in the ICU, starting exercise very early to try to help them recover more quickly once they leave the ICU.
The CanCold project is a big research initiative that's looking at how patients who are at risk for chronic obstructive pulmonary disease, COPD, may develop the disease, and then those patients who have the disease with a particular interest for early impairment, not those who are very severe, but early impairment, how the disease progresses, and with time, what can be done to prevent that progression, relieve symptoms such as shortness of breath, their flare-ups, and the activity limitation that they experience.
We're developing new ways to image the lungs. And that's important because until now, the lung has really been regarded as a very similar but large organ, and that disease would be distributed throughout the lung. And when you image any body part or organ system, you realize that disease is not spread evenly everywhere. It's concentrated in certain areas of the lung. And it's important for us to not only see where the disease is, but to see what kind of disease is there. So the work we're doing now really opens up a brand new way of thinking about the lung.
So I work on air pollution and how it affects the airways, particularly in regards to asthma and COPD. And because they're both so common and affect so many people worldwide and in Canada and has such a huge impact on quality of life, I thought that that was a good place to start.
What we study are the causes or the biological mechanisms for asthma. So what's happening in the lung at the level of molecules, at the level of cells, that is important in determining the altered lung function that one sees. So why is it hard to breathe? So we look at the cells responsible for that. We use that information to identify potential new targets for therapy, and we've developed models to test whether new molecules that we've identified through our more basic research might have some legs or potential as a new therapy for asthma.
I'm not a medical professional, but I'm pretty sure that without breathing, we got nothing.